Good afternoon, everyone. So we're going to get started on today's webinar on developing and maintaining a youth-led drop-in center for BIPOC youth and young adults. So who is on presenting? So my name is Andrew Palomo. I go by he, él, or they. I'm the Director of Community Strategies here at the National Network for Youth. So I do a lot of our community work out in the community. And I have the pleasure of introducing my colleague, my friend, and my co-conspirator in many projects, Chloe Cole, program supervisor at Project Silk, which is a drop-in center for BIPOC young people in Allentown, Pennsylvania, which is about an hour north of Philadelphia and about 2 hours west of New York City. Chloe is an amazing person and doing some of the accolades there. She's been featured in her local newspaper as being leader in the Black queer community, making her mark both at the local and national level. She was also featured in the local business review as the 40 people under 40 who are making huge differences in their community. And just a little bit about their bios. If you like Google Chloe, you'll get her amazing resume and all the things that she has done. Also last year or years ago, Morning America featured her as people who are making history during Pride Month. So just wanted to feature that. And currently in 2023, Influential Women in Pennsylvania is featuring Chloe Cole Wilson. This is from last year, so can't wait to see this year's spread on her. So Chloe has done a lot of activism work, specifically around Black queerness and LGBT issues in the Lehigh Valley in Pennsylvania. So it's a great honor and pleasure to have her here to talk about some of the experiences of like developing a youth-led drop-in center. So Chloe, hopefully I covered most of your accolades and wanted to see if there was anything you wanted to add.
Thank you so much, Andrew. It's so weird talking about myself. So a lot of the work too that I do is coming from a peer space. So my current position at Project Silk, I started off as a peer navigator. So I was really connecting with our communities and the populations that we were wanting to work with and engage with. And so it's really important for folks to know that like I'm really coming from like a homebred, really grassroots kind of style of social work and community engagement. And I'm from the area in which Project Silk is currently at. So I'm born and raised in Allentown. And that has been a really great way for me to connect with young folks at every level that I was. So I started as a peer navigator, then I was a housing case manager, then I was a case manager, and now I'm in this supervisor role. So just it's so important to love onto your community and make sure that young folks have access to these kind of opportunities because you'll never know where they'll be. So
as we're getting started, so I do want to just like do this word cloud activity with you all, because like when we say recreational safe place or even a drop-in space, right, or drop-in center, what words come to mind, right? It's like, so if you are able to, you can use your internet browser and go to pollev.com and go to NN for, and then enter NN for Y. Or if you want to text, because I know some of you are probably texting or scrolling through social media as we are speaking. So feel free to text NN for Y to 22333. And then you can just put in that word, right? Like put in that, like what comes to mind when we say recreational safe place and or drop-in space. And again, this is optional. So if you don't have access to any of this, no worries. You can put that word into the chat like Jennifer did. They put the word fun. I'll text that on your behalf, Jennifer. So we'll just take a few minutes for this, and then we'll discuss what you all said. And hopefully technology works. Oh no, it's not showing the responses. All right, never mind. It is not working. So I will, it is technology, man. Sometimes it works and sometimes, oh no, there it goes. I just had to refresh. So hopefully you're seeing my screen, right? So place where it could be safe, judgment-free, neighborhood-based, belonging, safety, fun, socializing, hygiene, creativity. Yeah, some of those words that like are coming to mind, right? Like, and specifically that safe place. Sometimes we'll use the word brave space, right? Like that brave space where people can come and like be challenged, comfortable, and where belonging. So the biggest words that I'm seeing here: fun, food, comfortable, belonging, right? Recharge, all right, like safety, right? Like all those words, those big words, are words that like when we say recreational safe place or drop-in space comes to mind. And I do want to like, in a few more slides, I will share what that difference is between a recreational safe place and a drop-in space is. So I'm going to deactivate it. So thank you for participating, and go to the next slide. Also, I want to do full disclosure that Chloe and I have been working with Project Silk. She actually helped me open it about almost 6 years ago. So, and one thing that she forgot to mention was that like she was originally recruited as yes, a peer support person, but also for the Youth Action Board was actually her first task, and then we hired her really quickly. And then as she explained, moved up from like a peer specialist to a case manager, and now the program supervisor. But originally the intent was that Youth Action Board that first started our drop-in center. And this is actually the first cohort, I would say, that was there of that Youth Action Board that still exists, is still running, still making influential decisions, programmatic decisions. But just wanted to put that out there because I think they always forget that, even though she was only in the Youth Action Board for like a week before we hired her. So why focus on BIPOC, LGBT youth and young adults, right? Like, so why do this, right? Like, and I think one of the reasons, right, is just the facts that we know, right? Like, so a lot of the information that I'm going to be sharing actually comes from Chapin Hall and their study, Voices of Youth Count. So some of you who are in the field, who have been doing this for a long time, have probably heard this a lot, right? Like there are 4.2 million young people who are homeless or experience homelessness in a 12-month period in the United States. Those are the numbers that Chapin Hall estimates based on their study. But even when we dig in deeper, right, like in that study from Chapin Hall, they saw that LGBT youth are almost double are at more than double the risk of homelessness compared to non-LGBT peers, right? Among youth experiencing homelessness, LGBT young people reported higher rates of trauma and adversity, including twice the rate of early death, right? Like, so this is the data that they were collecting through interviews, through surveys, and this is what they were finding. Homelessness stems from multiple factors beyond just coming out. So yes, getting kicked out because your parents don't accept you is part of that, but there's so much more that's going on, right? Like, it's not just a one-sided issue among young people who identify as being LGBT. The other thing, right? Like, I think this is like that like, I would underline this, like, constantly. Youth who identified both as LGBT and Black or multiracial had some of the highest rates of homelessness, right? So just, yeah, that's like when I say like, why focus on BIPOC youth, right? Like, this is like, we know that young people who identify LGBT are overrepresented in the homeless population. We also know that young people who identify as LGBT and are Black or multiracial are even further like overrepresented in this population, right? So just wanted to highlight some of those statistics, right? And then even this from Chapin Hall from Voices of Youth Count, right? Like, in every one of these categories, like from exchanging sex for basic needs to being forced to have sex to physically being harmed or to harming themselves, young people who identify as LGBT, their experience, they find themselves in these experiences more often. Yeah, intersectionality, Rihanna, 100% that word, yes. And again, like, when we look at the numbers, right? Like, so Black and LGBT had higher rates of homelessness, right? So 16% compared to some of the other populations that Chapin Hall was comparing to. Okay. So what is a safe recreational space, right? Like, so this is a huge, like, or a definition that was created by Dr. Mackey at the University of Pittsburgh in the School of Public Health, right? Like, because they created this concept, they created this like this recreational safe place in order to receive services as an intervention, right? So just wanted to put this out there, but then I'm also going to throw it to Chloe to have them explain how do they operationalize this, or how does this come into play in, like, when you're implementing it. But from ooh, did someone say something? Sorry.
CRT team and then a rec space. Those are very. So yeah. I did ask.
Sorry, I'm gonna have to mute some. Can you still hear me? Yes. So a comprehensive youth-centered structural intervention model that combines structural and behavioral high-impact prevention to provide a recreational-based community health space. Project Silk pairs recreational activity with health prevention counseling. Sorry, something is not working here. Yes, thank you, Eddie. If is this this intervention that puts both recreational activities with a health prevention, counseling, testing, and other services all into one. So this model, right, like it just like more than just one service, more than just housing, more than just mental health services. It's trying to put everything into a drop-in space. But I think sometimes we look at things like putting the services first, right? Like, but when we look at this, it really is this recreational activity first, right? Like, and this is what I think like makes it a little bit different, that like it really is those recreational activities that then allow people to then access services. Another way of looking at this, right, like is through a social determinants of health lens, that like it really is more than one specific service that we're providing. It's everything, trying to provide all of these services in one place in order to create a community where people have equal access to education, employment, health, connections, and family. At the center of it is like, right, young people and feeling of belonging and being able to be part of a community. And before I get to that, just want to show Project Silk in Pittsburgh, right? Like, and how they've been able to do some of this in Pittsburgh. So hopefully you can hear, if you can hear, Eddie, if you can put in the text, if you can hear the sound.
House ball culture, to me, it really is another family.
I feel like house ball represents the LGBT community by expression.
Ballroom was created as an underground culture to let the kids express themselves, where like in society they wouldn't be able to. We can be models, we can be runway divas, we can, you know, be the best dancers ever, and we're all there just to have a good time. When I was young and during my transition, we didn't have anything. All we had were the streets.
Project Silk is a recreation-based community health space. The impetus behind starting Project Silk mainly came from a series of focus groups that we were doing. We focused specifically on young Black men who have sex with men and trans women here in Pittsburgh. And one of the things that they said to us that really resonated with me was there's nowhere for us to go. And they weren't talking about services necessarily when they said that. They were talking socially. There's nowhere for us to go. There's nowhere for us to really be and feel like we belong here in Pittsburgh. They were really expressing isolation, alienation, lack of social support, all of these social determinants that we know are predictors for HIV risk and for HIV infection. And we thought, well, you know, wouldn't it be interesting if we took some of this information and really developed a program that's community generated, that gives them a safe space to operate, to be themselves, to feel okay about themselves, and to avail themselves of services such as HIV testing. If we can build all of those things into an existing community space where people want to be, then they'll probably use that.
A lot of people don't like to talk about the real issues because they're afraid.
You know, we have fun, we do different things, but the main, you know, subject is to make sure that the kids are okay, that they're safe, that they have what they need.
What we like to do here at Project Silk is that we like to have open discussions, not just about status in general. We touch on stigma, we touch on people living with HIV and AIDS, and through all of this, we are addressing how do we deal with people and that the fact that they are still human.
Everyone that comes here does not identify as.
Yeah, so I'll stop right there. And a lot of this, right, like, so just so people know from context, I did put in the 2 research articles into the chat, so feel free to download them so you can read how Project Silk was developed. The original model was in Pittsburgh, so this video is from the Pittsburgh model. And then Chloe and I spent like a good 3 years trying to replicate that same model in Allentown. It was originally focused on HIV prevention. However, and Chloe will explain a little bit more about this, it really is more than that, right? Like it is like all of the services, not just HIV prevention. I would underscore that MSM of color and trans women of color do have higher rates of HIV prevalence. So therefore, it is a vital component for this community, but it's actually more than just that. So just wanted to emphasize that in the original model, it was HIV prevention, but I think this works for all types of services. And that's exactly how it has been used. So I'll go to the next slide. So my first question, right, as people have seen this, got the reason why, we know that the data shows that BIPOC young people, specifically who identify as LGBT are overrepresented in the homeless population. We got this concept of a recreational safe place. And if you saw that video, a lot of it was the fun parts, having those recreational opportunities where people can connect and form those connections and form those bonds, and then the services come later. So my first question to you, Chloe, is in implementing it, what does it really look like, and what does it mean to you?
So I think something that's really important to think about as you are, trying to make these spaces or create these spaces or support these spaces is ensuring that there are all of these other elements. So recreational safe place, as far as like running one and building one, is ensuring that all the resources are like laid out and that young people have access. And so we utilize a few different roles in our drop-in spaces. So there's my role. So I am the program supervisor. I do day-to-day operations and ensure that the staff are able to do the work that they need to do. I also am a big part of hiring and retention. And so bringing in young people, right, who have the skill sets, as Andrew did with me, and really pushing and inspiring them to be interested in doing this work for their community is very important. And making sure that they have all the training, the support, and the interest. I say this all the time, like Project Silk Lehigh Valley has literally raised me. I got my license here. I went on and went back to school and got my bachelor's degree. And now I'll be wrapping up a master's program next month. So there are so many opportunities to build a staff that really looks like the community that we're trying to support and make sure that they have what they need. So yeah, and then we have a peer navigator who runs programming. Our current peer navigator, Michelle Wilson, was a young person almost 7 years ago in this program, and is now learning and growing into the peer navigator role. And then we have two case managers, Kylan Camburn and Kenneth Screven, who do all the case management pieces. So when Milo feels like cases are starting to become a little bit too much, or they need a lot more support, our case managers come in and just bring around that wrap up of care. So connecting them to HIV and STI services if needed, testing to treatment, making sure that if they need a therapist, connecting them to those resources, really being, when we did a focus group here for our older clients, one of the things that came up was this idea of being a healthcare concierge, which was this really fancy way of saying case management, right? So when you come into the center, right, there's all this beautiful messaging. We want to affirm our young people that come in. We have a Black Lives Matter flag up. We have trans flags up. We have a progressive flag up. And we want our young people to feel safe, seen, and heard, and feel as if, if there's a staff member here that they're working closely with, that they have access. And then our staff too are taken care of. So I really make sure that their supervision is tight, and we are talking about self-care, and we're modeling behaviors for our young people. So when I think about recreational safe spaces, it really is that non-judgmental piece with staff who care about the young people that are coming from the communities and understand, and it's youth-led. So we do have a youth advisory board, which Andrew talked about a little bit in the beginning, that I was a part of before I started working with Project Silk. And that board really guides what we do. If they're not interested in a service coming into the space, they have the opportunity to say, this isn't what we need this. That's what, to me, a recreational safe space looks like as far as operations.
Yeah, no, I totally agree with you. And I think even the word safe, right? What does the word safe mean? And I think you touched upon a few things, right? I think first, there's the client safety, that they're heard and that they feel that this is their space, right? And having those items like Black Lives Matter, and having And even the design of the space, it doesn't look like a clinic, right? Like, so I don't know if you want to like explain a little bit more about like even like how the space itself creates that sense of safety.
I think just making sure that you have plans, just as you do in any other space, about getting out, making sure that young people understand the expectations for the space. So when they're coming into the space, they know and understand these are the rules. These rules keep us safe, right? Like, you know, we can't fight here, we can't bring alcohol here, you know, all of those things. But the expectations are that, you know, you are really connecting with each other and creating a space of safety. And there are going to be times where that safety is questioned because unfortunately we're learning and growing together, and some things might, you know, agitate you. And I think that these are conversations we have weekly with our young people about our expectations and the rules of the space on a day-to-day. Also having programming that really speaks to them and is built on their needs, I think is very important. So day-to-day groups, we have one group that kind of sets off the day, and then they're able to really engage in the space whichever way they like. So if they need to get tested, they can come and get tested. If they want to meet with a friend and just hang out and be in the space together, they can do that. If they want to lead a group, we empower them and ensure that they have the finances to do so. So yeah,
and I think you bring up like some
space.
excellent points of like what does it mean to be creating a safe place and just even designing things that meet their needs, right? Like, so oftentimes like we create like even like programming or groups or whatever we call it in our spaces based on like, this is what I think you need, right? And therefore, and then like, it's not safe. They're like, it's adultism, right? Like someone is telling me what I need, right? Like versus like in Project Silk, it's like the youth action board or the young adult groups, they're saying, no, we want this, right? Like we want this and we want, how can you help us get this group because it's a need that we have, right? Like, and I think that's, and even the recreational activities, right? Like, I think like, it's been, it's ebbed and flowed, but like, I think like we've had activities similar to what was in that video, like, right? Like we've had, or tried to mimic like ballroom. There's no ballroom scene in Allentown, but we like tried to. I haven't been there in years, so I don't know if things have changed. But like I think like, you know, trying to get those spaces like where people can be themselves and have those recreational bonding opportunities. So as people are designing similar drop-in centers, or if they want to have something similar, what advice would you give them?
So I think one of the most important things is ensuring that funding's locked in for 5 years. I know that's a big ask, right? But one of the things that young people have reported back to us is that all of the things that they love in the city, right? There's a free dance class down the street. Or this park that they enjoy, they always get taken away. So if you really are going to be committed to creating a space like this, ensure that it's going to stay for a long time. A lot of our young people, as you've heard before, our age ranges, I mean, with all the grants that support our space, are between the ages of 13 to 29. So that's 16 years of opportunity to work with a young person. We have young people, we have a young person that is absolutely incredible. She's doing wonderful things. We met her at our summer camp. So we do have a summer camp for LGBTQ plus youth. And she was like on the tail edge of turning 13. And now she is like really growing into herself. She's in college now. She's been on HRT. She's doing great things, right? And I think it's so important that we find a way to make sure that our services are going to stay. So before you even start designing, really making sure that the funding is available and that the space has a commitment of at least 5 years. So that's like one thing that I think is really important. Another thing I think is really important is finding funding to do consultation with someone like Andrew or someone from the community who knows this work and knows the landscapes in which your sites are going to be existing. So consultation is important, and also in that consultation piece, as you're creating that plan, making sure that you have funding to pay young people to develop this space. Our space is constantly being developed. So it's constantly changing. Our programming changes, but the root of it stays, right? But we have young people come and go and create new things and leave, but we're still here, right? Being committed to the site for years to come versus just seeing it from a small scope. Again, it's this idea of like, this program is going to leave, and we don't want to promote that with our young people. And the last thing too is finding different ways to fund the work that is flexible. So we have a lot of our funding is in substance use disorders counseling. We also have a Access Matters grant, which is a state level grant that helps us do reproductive health and supports. And then one of our larger grants is around HIV prevention and HIV and STI testing specifically. So really making sure that your funding resources are really expansive, because there are going to be times in which you're like, oh, we need this, but we need to be able to have flexible funding to make things happen. We've thrown balls before. And have changed our funding in order to meet the needs for our young folks. A lot of our young folks really enjoy having those kind of events, and there is an opportunity for us to make sure we connect with young people. Oftentimes, we created another arm to Project Silk here at the Lehigh Valley called House of Shades, and so House of Shades is a group that really targets that 18 to 29 population in nightclubs. And so we were honored with a national award to continue our work 2 years ago. And so that money is used to just throw events and ensure that we can throw these balls at whatever level we need to so that young people can engage with us. And through that work, we were able to connect 4 young people between those ages of 18 to 29 to HIV care services. So that is the big part of this, is ensuring that those positive young people are able to get the services that they need through this outreach. So yeah, that's my advice. And I know it sounds like a lot, right? But I think like making sure that you are really committed to this work is absolutely essential, because young people, especially the young people we work with, these services come and go. How can we create sustainability and ensure that these services are here for lifetimes?
Yeah, thank you. And I think like something that you like really touched upon, right? Like is consistency, right? Like how do we then keep the funding going? And I think this is also like when I look at if there are any funders in the room, right? Like how do you fund programs like this that do last more than 1 year? And I think like that's something that like comes up a lot with our young people, especially like what you just said, that like things just don't last in our areas, right? Like, or like in low income areas, or in like what young people call the hood, right? Like things come and go all the time. And I think that's tough, right? Like tough, especially if you're trying to have a program and go somewhere and have that consistency, and it's not there, right? So I think that is 100% like where like how do we like end up supporting and funding some of these programs long term? And then even like I just like you were saying, Chloe, which is even some of the struggles we've had in trying to find funding, that like it's hard to find funding that is specifically for Black and brown young people who identify as LGBT, and then throw in trans women of color in there. It's like such a small niche, right? Like that, like, or not a niche, that's the wrong word. Right? Like there's not enough funders that like fund this type of work, right? Like, and I think that's that's one of the challenges like that, like we've had that, like, it's always about like, I remember talking to funders and just saying like, oh no, we need, why don't you accept all young people? And like, and not even funders, even just some staff people that we were working with. And I was like, yes, however, like, we know the data shows that this is the population that has the highest risk. This population needs services that are targeted for them to create this community. And we were having these discussions like 5 years ago. Now, like, right, like we have laws and that are coming down the pipeline that are restricting LGBT folk, who are restricting trans individuals. And more than ever, like, we need these spaces where young people can feel safe, right? Like, and I think that is one of the challenges, but then also one of the, like, it's a challenge and also like advice, right? Like also like this is what we need to do as a group, right? I don't know if there's anything else you want to add, Chloe. I know I went on a tangent.
No, you're fine. I mean, again, when you're designing these programs, it really is about ensuring that they're going to stay for long periods of time. I think we see trends and people see social work trends. They all exist, like what population we're going to be working with this year. And like having a commitment to these young folks means everything. I think about the young people who have been here from the beginning, who still come and visit and say hello, right? They know that we're committed to them. And the idea of leaving has been something we've struggled with, right? Especially when keeping the space afloat. But the absolute excitement they have when they hear that we've gotten more money and that we're keeping our doors open and that we're getting more funding and more opportunities is so exciting. And young folks are like, wow, you're really with me and you're really committed to my community. Thank you. And it just comes up in tenfolds and ripples across our community. So it's really beautiful work.
And I think something else, like even designing it, I think the other thing of advice, like, right, like, is designing it with the needs of young people in mind. And like, we talk about like human-centered design and how do we design these programs with that young person, or youth-centered programming, right? And like, what does that mean? And I think you touched upon a lot of that, which is like, yeah, we're going to listen to them and we're going to create programs that does meet their needs. I think that tends to be a little bit tough. And I know like with the youth action boards, I guess like my question is like, you know, sometimes it's like the same young folk. How do you like navigate like designing programs that meet the needs of the entire community? And that challenge, like, how do you then like navigate, like, is this group, this smaller group that represents this larger group, how do you navigate that complexity of like, is this representative of the larger community?
Mm-hmm. I think what's really important too is like where you're having your focus groups, right? Like we can't always have focus groups and like meetings about our services like in-house, right? Sometimes, especially for the House of Shades program, like we're having them during, you know, a nighttime event. So lots of late nights here. And so changing up where we are and becoming more of a mobile intervention too has been something that we've been embarking on in the last few years and have given us results. And so really changing the terrain, I think, is so, so important. We want to be everywhere, but we can't always be everywhere, but we can explore conversations and have different ideas with people in different spaces. And that has been really helpful in keeping the voices diverse. And then also giving young people different ways to connect with us. So sometimes talking in town hall style groups don't work for our young people. We also use our Instagram. Our Instagram is like one of our biggest tools as far as like promotion marketing, and also giving youth a space to have youth voice. So we do all types of surveys that are really fun and engaging to kind of engage young people in our day-to-day operations, like, what movie do you want to watch? And we'll post different movies in the surveys. And so like whatever comes up the most is the movie that we'll watch in the space. And so we've tried to find different ways using technology to really have young people like you find their voice and utilize different ways to share with us what their needs are and what we can do. And then also another thing that we do too is we collect a lot of data, and in that data, we do a lot of documentation. We really collect the conversations that we're having with young people one-on-one. And in those conversations, we make sure like, hey, like, is it okay that we share this information amongst the team so we can have bigger conversations about what services we need? One of the biggest things that was coming up for our young people in our individual sessions and our case management sessions is that a lot of young people were really struggling with substance use disorders and smoking. And so then that challenged us to look for funding to ensure that substance use disorder counseling and services were going to be a part of our general recreational safe space model. And so we were granted with the opportunity to have a SAMHSA grant that's 1.5, I think it's 1.5 million across 5 years. And so that grant has really helped us not only ensure that we have social media messaging around the importance of harm reduction and staying safe and drug use, and where do you get support if you are struggling with substance use disorders, but it gave us an opportunity to ensure we can hire more peer navigators as well. So really listening to the young people, collecting that data can bring you down places where you're able to expand your services and receive more funding to do the work.
Yeah, no, thank you. And I think like you've alluded to this question already in some things, but what are some of the challenges you've experienced in sustaining a drop-in center or sustaining a recreational based safe place?
So one of the biggest challenges I do believe is ensuring that our young people are understanding some of the political and social issues that are happening around us. That has been one of the biggest challenges that we really struggle with. We have a lot of legislation, as Andrew mentioned before, that are affecting our young people daily, and it's not because this legislation is being passed in the state that we're in. If you're in Florida, I'm sending a lot of love and healing energy to you because I know in Florida it is very difficult. But up in Pennsylvania, we're seeing these laws being talked about amongst these walls of legislation. And so that creates a lot of discomfort for our young people. And so that is a huge challenge for us. How do we ensure that young people are feeling like they are able to, have these conversations and feel safe after the conversations are had? Because we don't have all the answers. We're not controlling legislation. We can go out and vote and we can do all this support and all of these things, but we're not controlling legislation. And so those are some of the most difficult moments that I really engage with my staff and like making sure you're taking care of yourself. So that's one thing, some of those social issues that we struggle with, and acceptance, right? Like ensuring that you have a program that's in an accepting city is such a struggle, right? We are in Allentown, Pennsylvania, so the city is very accepting of our programming and we've been embraced, but we do have another site. There's like 4 Project Silk sites across the state. And so the below Harrisburg, they've had some tension and some difficulties with being in a much more rural space. And so I think it is very important that we are protecting our young people in this space. In this space, you're accepted and loved and cared for. And in this space, your pronouns will be respected. And in this space, we are going to constantly affirm you and ensure that you have the services regardless of your identity. And we're going to embrace you and care for you each and every day, even on the difficult days. because I know the world is telling you that you don't exist. And I know the world is telling you that you are not enough, but here you are enough. And we want to give you the tools that you can protect yourself from all of that negative messaging. So that's like a huge, like, and I know that's like an issue I think that comes across all of the programs that you are all serving or supporting or leading, right? Like it is just, it's unfortunate. LGBT youth and LGBT young people are under attack, and this is, it's difficult times. Another thing that's also a challenge too that I would like to share is like funding in general, finding that money that really fits what the mission is, and making sure that funders understand that the work that we're doing. There have definitely been times where funders are like, wait, why are you doing this? And so a lot of explanation, a lot of learning, and a lot of staying in communication is very important for us to ensure that the space stays open, while also just like respecting the boundaries of the young people. We don't want funders here all the time, right? Like taking pictures and like investigating and like making our young people uncomfortable, but we do want them to know what we're doing and, you know, present the amazing work that we're doing daily. So that's always like funders, communication, and all of those things too.
And I would add just like, it's not just funders, right? Like, I think it was also like even translating some of the stuff that we were doing, like why are we spending money on doing a ball, right? Like, which is, people didn't see that as I'm going to use social work terms, but they didn't see that as an intervention. It wasn't seen as something that like was therapeutic, right? Like, and for us, like it actually is, right? Like it's building community, it's having people come together, right? Like I think some of the largest groups like that we've had, right? Like I think that the one I attended one, I left at 10 p.m. because I'm old, and even that was a little bit late, but it continued later on. It was at the Brewworks, I think, and there was like 100 people there, right? Like, and that's like to host an event and have 100 young people come and then know that there are services available for them, right? Like, I think explaining that to funders or to other staff members and to explain that like how this is part of the culture of this population, right? When we talk about BIPOC young people and trans women of color, right? Like, and like this is something that like happens. And if any of you have don't know what ballroom culture is or all that stuff, like, right, like there's a movie, Paris is Burning, and then there's Pose, right? Like all those shows. We were actually up and running before Pose became popular. So we were doing ballroom culture way before, I think it's an FX. Anyway, anything I'm missing, Chloe?
I just wanted to go off to like having those community events like really built up your street cred. Like it really gives young people an opportunity to say like, oh, these folks are really here for us. And they're doing events consistently. They're here for us. They want to do this work with us. I think about Maslow's hierarchy of needs, and like that middle section, love and belonging, is so, so important. And so like really ensuring that like these events exist so that young people can also build community within themselves. We are not going to be around all the time, right? But some of the relationships that we've seen our young people build amongst each other has really been a catalyst to their safety outside of the space. So they're able to say, you know, we're going to build a safe and healthy friendship group, right? And they take the lessons from Project Silk, built those in, and they use that as survival, which is really amazing and can really help our young people, you know, thrive even after. And then also too, I think some other challenges I just wanted to highlight super quickly was like finding the right space. Like that is such a difficult challenge because oftentimes we don't know if a space is going to be safe and work for us until we're in the space for a couple of months. We just moved to a new space and we've already like found some issues that if we were to find another space that we would, you know, change. And then also, again, that community acceptance. Sometimes, our neighbors don't really understand the work that we're doing, and they sometimes struggle with the work that we're doing and address it with us. And so that's been a challenge as well, finding the right space, because as we grow, our youth are growing with us. So sometimes we get so many youth in one space, and we're like, oh man, we might have to find a new space, an even bigger space, a bigger layout. And, we're talking about fire safety and ensuring that there are exits and, all of those kind of things. But yeah, really standing for the program's mission can also be a challenge for us too. And finding a space that physically does that for us can be a challenge as well.
Yeah. Thank you, Chloe. And I think, and yeah, spacing is always is this big enough? Is this small enough? Does it have everything that we need? Right. I think that's definitely something. It's because you don't know what the usage of the space is going to be at any time. The interesting thing, going back a little bit about those community events, and we talk about outcomes because that's something funders love, right? So something that we definitely have seen is that once in those community events, either during the event or a few days after, we did see uptick in service utilization, right? So at that time, the grant was HIV prevention. So we knew if we had an event that there would be more people coming in for testing, right? And I think that same model can be used for any service. I think any community event will then lead to higher service utilization, which whatever you're catering to at that time. So, I mean, that's just evidence that it works, right? Evidence that the recreational safe place works. And then the last question, which is a loaded question, how does racism and racial inequality impact Project Silk, especially when we're creating these spaces specifically for BIPOC youth, right? So how does that impact our work? Yeah, so I'll leave it there.
Yeah, so I mean, I talked a little bit about this, right, your community accepting the work that we're doing. The work that we're doing is very radical, but it's not at the same time, right? It's offering and ensuring that there is a safe space for recreation. I don't think that's very radical, right? What makes it radical is, the populations in which we are affirming and making sure that they have their needs met. And so oftentimes, I think racism and racial inequality can impact our services each and every day. Microaggressions, macroaggressions, all of these things impact how our young people are served and who will support our work and funding our work. We have a lot of funding allies that really believe in the work and believe in ensuring that we have this space for our young people. And so having those allies with us who are learning and growing with us to ensure that the space continues to exist for lifetimes on has been really, really beautiful for us. But yeah, each and every day that young people, again, see what's happening in social media, see what's happening as far as the political and social strife that we are in as Americans right now, is constantly impacting their mental health and their well-being. And so they come here and they bring these conversations to us. And it's constantly shaping our programming because we are having this conversation again, I was called a racial slur at school. How do I address that? I'm constantly being misgendered at home. What does that mean? And so when we're talking about racism and racial inequities, I think it's very, very, very important to understand that there needs to be a space for young people to have these safe conversations and really grow from them with their peers. So we used to, in the beginning, when Project Silk was really starting to build out its programming, one of the things that we used to do is roundtable discussions, and we would talk about controversial things like racism and religion. We would have these conversations, and our young people had these very amazing and heartbreaking stories of how they overcome these situations and issues. So it's real simple. Racism and racial inequality impacts our young people. So it impacts our space and how things are moved and what we talk about and how we protect them, ensure that the space is safe. Yeah, we're in a really interesting time. 2020 put us all in a space of isolation. And now we're in this place where we're really starting to have some reckonings about some of the issues that racism and racial inequalities have caused and how it exacerbated during the pandemic. And our young people are so amazing and articulate, and they want to have these conversations because they're having these experiences and they want to be together to do it. So yeah, unfortunately, racism and racial inequalities impact all of us to some degree each and every day of our lives. We're constantly interacting with it.
Yeah, and it's also it's coming at us at all levels, right? Like, because I even at so our young people at the individual level are experiencing out in the community, and then I just recall us constantly at the program level, people questioning what we were doing, right? Questioning why we were doing this, right? It was just and even people that was working within our own program was no, we should open it up to all young people, regardless if they're Black or brown. And I'm we're not denying services to anyone. We're just targeting services to a particular population. And it was just really hard for people to wrap their brains around that, right? I just remember constantly trying to defend why we need to focus and stay on track, because often we would go off off track, and then we have to correct it and come back, right? And be this is the population we're servicing. They have the highest need. Let's target them, right? And then even hiring practices, I think when we because we wanted peers, right? And I think that was another uphill battle, right? Another uphill battle that was just right? Because we had these high educational standards in the organization, it just prevented people from the community to be part of the work. Eventually, we did erode that, right? I think, but it took time, right? And that's energy, and that's frustration on our end, and so it was just a lot. And then in the beginning, having what Chloe was talking about, support, right? Because now you have a group of young people who, hey, now that you're working with, they're no longer clients, they're now your colleague, and how are you providing them support moving forward? So we are at time. So I just wanted to also just put something in the chat, right? Let's see if it works. Oh yeah. I did create how can you support programs like Project Silk? I did create a GoFundMe that's specifically for Project Silk. So feel free if you want to share it, and no obligation, but I always love supporting LGBT Black and brown organizations in doing that. And then just my own personal note, I identify as being gay and grew up in Allentown when there was no LGBT drop-in center. And it's one of the reasons why no, this needs to be part of every community, and specifically for BIPOC youth, because they need that space. They need a space where they can vent. And when and just my own personal things, navigating these white spaces was always really complicated, because I can't discuss certain things, or certain things were dismissed because no one felt or didn't have the same experiences as myself, right? And I think that's something about BIPOC youth-led BIPOC spaces where young people can come together, and there is some shared experiences, and they can have that mutual aid with each other, and being able to help. So I will stay on for, I know we are at time, so those of you who need to leave, perfect. And if anyone has questions for Chloe and I, we'll stay here for another 5 to 10 minutes, or until everyone leaves the room. So that is that.